Hey guys, my name is Ryan Pika, and today I'm going to talk to you about a condition known as keratoconus. Keratoconus is a condition that roughly about 200,000 Americans suffer with every year, and a large amount of these people that have keratoconus don't even know they have it until it's too late. So, what exactly is keratoconus? Keratoconus is a condition where the cornea of the eye over the time starts thinning and bulging outwards and becomes more cone-shaped. Think of it like Bugs Bunny when he sees something amazing or beautiful. His eyes just bulge out there. Well, that's more of an extreme case. But let's take a look at this diagram to see what a realistic keratoconus looks like. On the left-hand side, that's a normal eye. On the right-hand side, that's a keratoconus eye. As you may see, on the right-hand side has a little bit of a bulge in it. That little Bugs Bunny boing look, yep, that's realistic. Now, on this x-ray, you'll see different colors. This is a realistic x-ray. I had one of these myself, unfortunately. And well, on this x-ray, you'll notice there's different colors. The darker colors like red, these colors represent the eye pressure in the eyes. This is pretty much when I found out I had keratoconus, and I was diagnosed roughly about 2 years ago. And if you do not treat this condition, it can lead to more serious conditions like a corneal burst, where the only thing you can do at this point is get a corneal transplant. A corneal burst is very serious and can lead to complete blindness. So make sure you catch this disease or are taking care of it. But what does someone with keratoconus actually see? I have keratoconus, so I can definitely relate to this. A person with keratoconus, let's put it this way. A normal person, they see a moon, or they see a light, or they see a person. A person with keratoconus, on the other hand, they see a moon times 7 times 8, a light times 7 times 8. You see things multiple. It becomes very blurry. And it's a very difficult situation to be in. It's like I mentioned before, it's very difficult, and I was diagnosed with about 2 years ago, but had this condition since I was young. I played sports my whole life, and when I was about in high school, I remembered one day I just could no longer see a baseball in the air with no clouds in sight. At this point, catching a routine fly ball became one of the hardest things I could ever do. It was very embarrassing, and it's a very difficult condition to have. And if you have it, you're definitely not alone. But how can you improve your vision? How can you improve this vision? It's called rigid gas permeable contacts, or RGP. They're these little tiny little contacts that you put over your cornea of your eye. It helps that little round shape, so that way you could actually see things more clearly and not multiply by 7, 8, 9, 10. But what about preventing this condition of keratoconus? You could do multiple things. One, being it intact. Two, continue wearing these RGP contacts, but I'll tell you, they're not fun to wear. They're very uncomfortable. Doing things like swimming, normal activities, it sucks because you can lose them. They're very expensive. You can get dirt in your eyes and you're crying, and if you don't have the right equipment to take them off, it's just a pain in the butt. Well, the other thing is the newly FDA approved cross-linking procedure. What is cross-linking? Cross-linking is where they put riboflavin phosphate eye drops in your eyes. And while they're doing that, you're staring at an ultraviolet light. This procedure takes roughly about 4 hours. It's definitely not very comfortable. They're keeping your eyes wide open this whole time. It's definitely going to be painful, but the goal is to stop the progression of keratoconus so you don't have to worry about experiencing things such as a corneal burst or having a corneal transplant. I will be going in tomorrow, so I'm going to leave you with this. Take care of your body. It's the only place you have to live in. So, hopefully, I'll see you soon.